And the thing that is frustrating is that oftentimes people with PCOS will be prescribed hormonal contraception to manage their symptoms. And that just adds fuel to the fire, because now you've got synthetic hormones on board suppressing already out of balance hormones. But we know that the combined oral contraceptive pills can often increase insulin resistance.
Dr. Carmen James, so excited to have you on the show today.
Thank you so much for having me. And Carmen is fine.
So just to introduce you and a little bit about your background, you're a medical practitioner,
yes.
integrative medical practitioner, lifestyle and botanical medicine advocate. I know you work with cannabis as well,
yes.
and specialize in women's health. So it's really fascinating. How did you find this direction in your work?
Yeah, so it's a good place to start because I fell into medicine kind of accidentally. I didn't actually know what I wanted to be when I left high school. Applied, didn't think I'd get in, and it was really my love for biology that kind of got me into medical school, and kind of kept me there, I suppose, because when I was in high school, there was this medical student who came to give us career advice and guidance, and she said, medicine is just glorified biology. And I was like, that's what I need to do, because I love biology. So I battled through medical school just to kind of find my vibe and find where I belonged, and considered leaving a couple of times along the way. And then when I started working, I really just wasn't feeling that fulfilled in what I was doing. And the longer I practiced and the more I worked in different scenarios, worked in government, worked in private, worked on the ships, I started feeling unsettled with this idea of just prescribing more and more medication for often reversible lifestyle diseases. And I didn't feel empowered. I didn't feel equipped to be able to give patients advice on what they should be doing or what they could be doing to manage some of the things they were going through. And so I met a colleague who had done Chinese medicine, and I was discussing a patient with him. And he said to me, oh, you should consider putting this patient on cannabis. And I was like, oh, cannabis? What do you mean? That's a drug of abuse, We should be getting patients off that stuff. What are you talking about? And he's like, okay, I'm just going to give you the information. You can look it up on in your own time, and then you can decide. And that's when I started looking into the world of plant-based medicines and cannabis specifically, and then this idea of healing. Because at medical school, we learned a lot about disease and about medicating illnesses, but not a lot about what it takes to be healthy.
Yeah.
And so that's really what led me down the path of inquiring more about okay, so what is health about then? And how can we optimize that, and how can we learn more about supporting our body in doing actually what it should be naturally doing and what it does naturally.
Yeah.
And that's really, how I started looking at integrative medicine. And I found that a lot of the people who were reaching out to me were often women, dealing with period issues, hormone issues, and so I started focusing a lot more on that stuff. Yeah.
Well, let's talk more about hormones, because if you drill down into a lot of these afflictions, you can find that hormones are at the root of many of them. Yeah. So maybe if you can explain simply what hormones are and the role in the body.
Oh, great. So hormones are basically chemical messengers in our bodies, and they're part of the endocrine system. And they're really, I know for myself, in the people that I speak to, a lot of the time we focus a lot on like the reproductive hormones. So women's hormones that control the menstrual cycle, like estrogen, progesterone, testosterone. But there's so many other hormones, that are at play. And really what these hormones are doing is that they're sending messages around the body to do or to get certain things done. And if we think about the world of hormones, I like to think about it like an orchestra. So I recently went to go and watch the Philharmonic Orchestra, and it's always like, I just get goosebumps. It's always like a thrilling experience. But if you kind of think about like each like component of the orchestra, kind of playing their unique instrument in harmony with the rest of everyone else. And then if you think about what would happen if one of those people were to be playing like to their own tune, or like the instrument was out of tune, or they're playing at a different timing, the resulting music would not be as harmonious. And so our hormones really should be working in harmony with each other in order to bring homeostasis or balance. Yeah. And so, aside from the reproductive hormones, we have hormones like ghrelin and leptin. I like to call ghrelin the gremlin. Yes. It's a hunger hormone. Leptin, the satiety hormone. You've got insulin, a huge hormone that I think a lot of us like overlook when it comes to balancing our hormones and achieving homeostasis. And so all these hormones are basically overseeing and causing our body to function in a way that enables us to just experience health and well-being. And the problem is that when one or a few of those hormones are not doing what they should be doing, it has a ripple effect. And oftentimes when we look at like why people come to the doctor, they're coming because they're experiencing some kind of symptom, They're feeling very stressed out, or they can't sleep, or they have pain. And when we look into it, oftentimes we would medicate that symptom, but we have to go back and peel back the layers and say, well, why is this person experiencing this symptom? And what are some of the root causes of that? And a lot of those root causes can be tied or linked back to our hormone health. Yeah. And
so with the hormones, a lot of them are buzzwords these days. We're talking about insulin and, like you say, leptin and ghrelin. But maybe it's also important to highlight that none of these are bad hormones. So we shouldn't look at one or the other negatively, but it is about establishing this balance. In the body. But maybe you could talk about some of the consequences of some being out of balance, maybe the not so common ones.
Yeah. So if you think about something like, when you haven't had a good night's sleep, right? So let's say, for example, you're tossing and turning, you don't have a good night's sleep, and the next day you wake up and you're feeling not only tired, but oftentimes you'll feel a little bit more hungry than usual. And when that hunger hits, it's often not like a broccoli salad that you're going to crave, right? You're going to be looking for things like, like a burger, or like, something like a donut, something that's going to really just give you a little bit of pep in your step, just like a quick hit of energy. And a lot of that is linked to how a lack of sleep then influences our sense of smell and our seeking for sugar, and how that that seeking out energy is linked to, for example, the hunger hormone ghrelin. So ghrelin is that hormone that really makes our tummy grumble, makes us really feel like we're super hungry. But that hunger is oftentimes not linked to like a true sense of hunger. It's linked to us seeking out energy. And so when it comes to the knock-on effect of things like insomnia and things like, just stress affecting our ability to sleep. That imbalance of ghrelin and then leptin being the satiety hormone is something that we can commonly see. When it comes to like the female reproductive system, a common condition that we're seeing more and more of, and I think we'll talk about it later, is polycystic ovarian syndrome. And really there, what we're seeing is an imbalance in two very important hormones, insulin, which we hear a lot about. But in women, we're seeing an imbalance in androgens as well. And that excess in androgens is interestingly actually related to that excess in insulin. But commonly what women don't realize is that we need it. We need testosterone. We need androgens. Androgens are vitally important for things like our libido, our sense of drive and purpose and motivation. And commonly, when women go through menopause, for example, and we see this drop in their androgens and the drop in estrogen, oftentimes a woman will say, like, I don't feel motivated to do anything. And so understanding that while we do need androgens, sometimes the scales can tip, and that excess in the androgen can actually also cause symptoms to manifest of androgen excess. And then I don't know if there's any other specific hormones that you wanted to.
That's good. I think it brings up two interesting points. The first one, when you mention ghrelin and how it stimulates that feeling of hunger and you're seeking something, does it not also link to your dopamine reward system?
Absolutely.
Because so maybe there's some interplay there. Yeah,
absolutely. And this is a great, when we actually think about, for example, people with attention deficit disorder, or people are often actually seeking out that dopamine hit. And so when we talk about like hacking your environment or like hacking your day to like improve your productivity if you have ADD, oftentimes what we're doing there is we're giving you some dopamine throughout the day to make you feel better. But certainly food is a pleasurable, we eat for nourishment, of course, but we also eat for pleasure. And I was actually talking to somebody just this week who was telling me about how she had gained so much weight, and the reason was because she was using food to medicate how she felt emotionally. And that's a common thing that we see as well, like past trauma and negative experiences can make us feel like we do need something to make us happy hormones,
to give you that little
little boost. And then sometimes, and I mean that's not necessarily a bad thing, however it can become maladaptive, and people can use that dopamine hit that they get from certain activities like eating food as a coping mechanism, and then that can potentially end up leading to things like eating disorders and a dependence on food for pleasure. Because I think as human beings, we're either moving towards pleasure or away from pain, right? So that's literally like life, right? Either we don't want to be in pain, and whether that means like we suppress the pain, or whether that means we just ignore it, or like, or we move away from the pain because, and we adopt like new behavioral things. Like for example, if you know that, you're not happy with your weight, you may decide to take lifestyle changes, or we're moving towards pleasure. And that's
coping strategies.
That's again, and exactly. And that's again, like when it comes to things like ADD, how can we make like the mundane things more pleasurable for people?
You brought up ADD, and I know your husband's a comedian, so I'm going to tell you a little joke. So I know this person that's got UHD, ADD. It's ultra high definition, attention deficit disorder. He can barely pay attention, but
Wow.
when he does, it's unbelievably clear.
Oh gosh. Oh, that's a good one.
Carmen can use that.
I'll tell him to watch this
Yeah.
episode.
And the other interesting point that you raised that I think most people are unaware of is that they have hormones that they consider to be of the opposite sex in their bodies. So men have estrogen,
Yes.
and women also have testosterone in their
Yeah.
bodies, but obviously in different quantities and balances.
Yes. And it's interesting what happens when those quantities and balances actually shift. And, we see this interestingly in women where, insulin resistance can drive androgen excess, which can lead women to start like growing
Yes.
unwanted facial hair, losing their hair and the top of their head. And then in men, we see the opposite
occurs.
happening,
Yes.
where they actually produce more estrogen
Yes.
as a result of the insulin resistance. And they
Yeah.
start growing man boobs, for example.
Yeah. And the body feminizes
Yeah,
with insulin resistance
Yeah.
and fatty liver disease. And
that's
so on.
it. And the
Yeah.
testosterone drops.
Yes. Yeah.
Yeah. So,
So, and before we get on to like metabolic syndrome and those things, I think another problem to discuss, problem that we experience in society today, I think with industrialization of everything, we have endocrine disruptors in the world that didn't exist 100 years ago. And this is in the food that we eat, in the fabrics that we wear. It's literally everywhere. So maybe you can give us some
yeah.
tips.
This is a fascinating area that I never learned anything about at medical school. I had no idea that this was actually something that could have such a huge impact on our health, and especially on our hormone health. When we talk about endocrine disrupting chemicals, I mean, the name says it all. Chemicals in our environment that we are literally exposed to all the time, that can either mimic, block, or interfere with the function of the hormones in our bodies. A common group of these chemicals are known as xenoestrogens. And xeno means like foreign, and obviously estrogen. And that means that it's an estrogen from the environment that comes into our bodies that we didn't make ourselves, but it has the ability to impact
Yes.
our endocrine system in a similar way to estrogen, or even block the effects of estrogen. And this is a huge topic, and it's still evolving. I think the science is actually still, we're only beginning to understand what these chemicals can potentially do. But in women, for example, and men, the effect of these xenoestrogens is that they can result in what's known as a relative estrogen dominance. So that interplay between estrogen and progesterone is quite a delicate balance that results in like a normal menstrual cycle and helps us to stay in balance with regards to our reproductive health. But the influence of these xenoestrogens can actually wreak havoc with regards to how our estrogen functions. Common place where we find xenoestrogens is in plastic. And if you think about the amount of plastic we are exposed to all the time,
Yes.
we have these plastic drinking bottles, our food containers are in plastic. It's especially a problem when the plastic is either heated
Yes.
or exposed to liquid. And so what happens is that those chemicals in the plastic can leach into the food or in the water. We drink that and it stays in our bodies. There are a number of other chemicals, and some of them are actually labeled forever chemicals. And this is a particularly problematic thing, because what it means is that because we're exposed to these chemicals, they potentially can hang around in our bodies for life. And so, I think it is important for people to be more aware of how they may be exposed to these chemicals. A good example of because it can be overwhelming, right? Because they're everywhere. But a way to think about it is definitely plastic. And then anything like non-stick is also something that
Teflon
anything whether it's on your fabric that's been coated, raincoats, the non-stick on your pans. I mean, if you think about that, oftentimes that non-stick coating, it erodes over time. And if you think about the fact that you're heating it all the time when you're cooking, you're getting a big dose of those chemicals every time you eat a meal. And so, limiting our exposure to these things, but also we find that there are chemicals in, and I know people are going to say, oh, I'm just living a bubble there.
Avoid everything.
Burn the whole place down. Just forget the whole thing. But there are steps that you can take. So I would definitely say, trying to reduce your exposure to plastic. Definitely don't heat food in plastic. And try not to drink liquids that were in plastic. You can keep your plastic, and I know people are precious about their Tupperware and that kind of thing. So you can keep that stuff for dried goods. That's probably as far as I would go with that. Definitely non-stick and plastic coatings and that kind of thing. And then when it comes to the chemicals that the products that we commonly use on a daily basis, things like, for example, our personal care products, the lotions and the creams and the deodorants and that kind of thing, it's so important for you to know exactly what's in those products. Because looking out for things like phthalates and parabens and fragrance, big one, all of these can potentially disrupt our hormones. And then cleaning products is another one. We always want to be wiping surfaces down with these highly toxic chemicals and that kind of thing. And yes, they'll sit on the surfaces, but they're also going to evaporate into the air and affect your air quality. So some things that people can do there is, read your labels, choose cleaning products that don't have those chemicals. Make your own sometimes. It's quite easy to make some of these things. And then ensure good ventilation in your home, and even plants can absorb some of, can help to improve your air quality. And so it's really about trying to think about okay, when somebody comes with a complaint of it's PCOS, it's endometriosis, it's a heavy period, a painful period, whatever, insulin resistance, regardless of what it is, I do think that taking that holistic approach, people may be wondering what do my cleaning products have to do with my insulin? A lot. And these are some of the things that we can actually look at and change.
Because all these little factors compound.
Exactly. If we look at what's causing this particular illness, it's never one thing. It's always going to be a few things that are coming together to produce the disease. And a lot of the time, people will say, oh, it's just in my family, it's genetic, oh, my granny has diabetes and so does my mom. And, but just because you may be predisposed to a certain condition doesn't necessarily mean that you have to have that condition. But it also means that even if you do have that condition, there are things that you can do to help you manage some of those symptoms.
So I do think also we can label many things as genetic, but they're actually rooted in inherited habits and lifestyles, because we're eating the way our parents ate, using the same products, adopting the same lifestyles, the same level of inactivity, and these all contribute. But when you look at it in a bubble, you'll say it's genetic or hereditary without considering these factors.
And that's where the interesting world of epigenetics comes in, and really looking at, okay, your genes, it's your code, it is what it is, it's there. But actually what's influencing that code? epigenetics is above the genes.
Yes.
So what are the things that are actually switching those genes on and switching those genes off?
Yeah.
And we now know that, epigenetics can actually be passed on. However, we can potentially make certain changes that can start to rewrite, especially for future generations as well, and also it gives us hope. I feel like sometimes people, when they receive a life-changing diagnosis, it can really be like earth-shattering and consuming. And it's normal, I suppose, to feel like hopeless, I guess, in those situations. But I do feel like there's a lot of opportunity even in those situations for us to say, there may be things that I cannot control. Maybe I can't control the fact that I got this diagnosis or my genes or, whatever trauma happened to me. But let's not focus on that. Let's focus on okay, so what are the things that are potentially in my control? And what may I be able to do to even make the situation a little bit better? I think it's a more hopeful way.
Yeah, definitely.
Of looking at our human condition, but also there's a lot to say for how that approach may potentially influence our state of being and our mindset. And that mind-body connection is also a powerful tool that we can use for healing. Yeah.
So I imagine that in your journey, you mentioned the frustration with medicating too many of these chronic diseases. And many of these diseases of civilization have their roots with hormonal imbalances. And this cluster is something that's termed as metabolic syndrome. So maybe you could discuss what that is.
Yeah. So metabolic syndrome, I always say that in medicine when we just want to group a lot of things together, we call it a syndrome.
Yeah.
So metabolic syndrome is basically like a group of things that we bunch together to kind of predict or estimate your risk for things like heart attacks, stroke. And essentially diseases of lifestyle or just the manifestation of the environment that we live in. So things like weight gain, especially like central weight gain. People may be like what we call apple-shaped or pear-shaped. But really that accumulation of weight around the midsection is a particularly worrisome sign because it tells us that you potentially have fat accumulating around your internal organs. We see high blood pressure and blood sugar imbalance, whether that's related to insulin resistance or frank diabetes. And interestingly incorporated in metabolic syndrome is also a low HDL cholesterol. When we learned about cholesterol, we learned about good cholesterol and bad cholesterol, and we always learned that HDL is the good cholesterol, it's supposed to be higher, and LDL was bad. But yes, we see people with lower HDL and high triglycerides. But really, what's happening here a lot of the time, or when we look at the root cause of disease, we see more and more that insulin resistance seems to be playing a pivotal role in how the body actually begins to get out of balance and stop functioning optimally. And we see and it's so interesting because I'll bring up insulin resistance, with people who, for example, PCOS. I bring this up a lot with people with PCOS, and discussing the role of blood sugar and insulin resistance. And oftentimes people will say, "Oh, but my blood sugar is normal.
Yeah,
I don't have diabetes. There's nothing wrong with my sugar. It's fine. Even my A1C is perfect." And it's really about understanding this idea that before the wheels pop off and you're diagnosed with type 2 diabetes, there's a long process that happens before that.
Decades plus, yeah.
Yeah. And the signs may not, it may be subtle, but really with insulin resistance and like unpacking metabolic syndrome, a lot of it comes back to how we think about our food and how we think about, the impact of specifically sugar on our bodies, right? So it's hard to live in the world we live in because sugar is in
every single thing.
It's everywhere.
Yeah.
And so, one of the things I do like in workshops and that is that, like, I'll usually bring a few food items and I'll like go through the labels with people and actually calculate like how many teaspoons of sugar is in this particular food. And that's usually what starts people like realizing that, hang on, because a lot of people will tell me, I don't have sugar in my coffee, or like, I don't add sugar to my cereals or that kind of thing, but we don't realize.
My cereal is sugar.
You're eating a bowl of sugar.
My rice is sugar, my bread is sugar, everything
is sugar. And so, and again, as you said earlier, the food that we kind of grew up eating and the food that we kind of feel like is normal to eat, really unpacking that and saying, okay, maybe it's not about, the carbohydrates or the sugar or the food that we're eating, but it's like how we think about food and how we actually make or potentially can make choices throughout the day that can give us the best end result. So when I went to, when I was with IIN, we learned this term called bio-individuality. And I love it because, when we try and like prescribe certain food for people can get like quite like uptight about it, especially if you're like the only one in your family who's like on a health journey and you want to eat like low carb or like, and you're like fussy about sugar and that type of thing. Everyone else is just like, we don't care, like, let's just,
you only live once.
Yeah, exactly. Like this life is way too short for this. Like exactly. But it really is about like, because ultimately if we're too restricting, that is not sustainable, okay? But oftentimes you'll find that people can make even small changes to kind of start the journey and start moving towards optimizing things like their blood sugar control and that kind of thing. And so really with metabolic syndrome, what we see is that it's the manifestation of a group of or a few lifestyle choices, things that we're doing consciously or unconsciously in our lives that are basically not allowing our bodies to function optimally. And the long-term risk of that, of course, is things like diabetes, hypertension that can progressively become more and more difficult to manage, increasing your risk of having cardiovascular events, strokes, and that kind of thing. And so you mentioned like you're adding more years to your life or adding more life to your years, right? So do you want to live like this long life that's miserable, or do you want to actually live like a really full, vibrant life, even later on in life? And so when it comes to the way we think about food, and how we can eat potentially to produce health rather than promote illness, there are a few things, that we can focus on. And I suppose like the first thing is sugar. And I know a lot of people get like very touchy about sugar, but definitely like eating large amounts of refined sugar and refined carbohydrates, things that are going to spike our blood sugar, spike our insulin, ultimately are going to lead to insulin resistance.
Well, let's talk about insulin in that context, what its role is and what leads to insulin resistance.
Sure. So insulin, I like to think of insulin like a key that unlocks our cells. So all our cells have receptors for insulin. And essentially what's happening is that our cells need energy in order to function. And the food that we eat, we can use the sugar that comes from the food that we eat, or even fat, to energize or provide the cells with energy in order for them to do what they need to do. So you eat a meal, your blood sugar goes up, but you don't need the sugar in your blood, you need the sugar in your cells. But in order for the sugar to get inside your cells, it has to go through the door. But insulin has to unlock the door to let that sugar in. And so what happens every time you eat a meal, your blood sugar your sugar level will rise. Your pancreas will start to produce insulin, more keys to unlock the cells, and then the sugar will be transported into the cell for whatever it needs to do. But what happens when we have these huge blood sugar spikes from eating, very sugary food or lots of refined carbohydrates, what happens is your body says, oh, hang on, there's more sugar here, we need more keys. So it'll produce more insulin. And then eventually what happens is that that roller coaster of spiking blood sugar causes your body to produce more and more insulin. But what we see is that the insulin starts to become less effective at unlocking the cells. And I've heard the description that it's similar to like if somebody put bubble gum in the lock. So insulin is there, it wants to unlock the cell, but it actually is ineffective at doing that. So it's the combination of there's high insulin, but there's also this ineffectiveness of that insulin. And insulin really drives fat production, right? And interestingly, what we see there is that because we are seeing more accumulation of fat, of course, eventually people will begin to naturally store more fat and gain more fat tissue and gain more weight. But for example, when we look at insulin resistance in the context of PCOS, insulin actually is stopping the conversion of estrogen from testosterone to estrogen.
Yeah.
And when we see that happening, what happens is that now this pool of insulin that's kind of sitting in your ovaries blocking the production of estrogen, you're ultimately going to see a rise in testosterone or your androgens. And that's really why when it comes to PCOS, understanding that part of the root cause of the symptoms that you may be experiencing links back to insulin resistance.
Yeah.
And we see like 70% of people with PCOS will be insulin resistant. Normal blood sugar, but high insulin level. And that high insulin can then cause some other signs and symptoms to develop. Some things like, of course, people will start gaining weight. And oftentimes women with PCOS will tell me, I don't eat that much, but I'm still gaining lots of weight. Or I've been trying to lose weight, but I can't seem to get anywhere. I'm not achieving my weight loss goals. And that's because insulin resistance also is tied with inflammation. And so when we see this combination of high androgens shutting off ovulation, insulin resistance, inflammation. It's like this Molotov cocktail.
Yeah.
And it's no wonder that it's so difficult for people who are going through and experiencing this condition, why it's so difficult for them to actually gain control and be able to achieve their weight loss goals. But moreover, when it comes to PCOS specifically, what's happening is that we're shutting down ovulation. And so one of the things that, people with PCOS will complain of is the infertility that comes with it. And that's, of course, as a result of having these very long menstrual cycles where you're not ovulating. And so it can be a very complicated condition to manage because it's so layered. People experience PCOS differently. And for some, it may be, the weight gain that's the major problem. For others, it may be the excess androgens causing things like acne, abnormal hair growth. For others, it's the fertility that's the main issue. But really, even just, trying to unpack that, there's so much that we can do. Really, yeah. I mean, when it comes to like what are the lifestyle things that we can do to help support you, and the thing that is frustrating is that oftentimes people with PCOS will be prescribed hormonal contraception to manage their symptoms, and that just adds fuel to the fire because now you've got synthetic hormones on board suppressing already out of balance hormones. But we know that the combined oral contraceptive pills can often increase insulin resistance. Yeah. And so, and this is, I mean, it's a huge problem because oftentimes people will ask like, I have PCOS and I'm, I was prescribed the contraceptive pill. What can I do to balance my hormones?
Yeah.
It's hard because the conventional knowledge, I mean, I was there. I was prescribing contraception for any and all period problem, and so I know what that's like because but when you really think about it, it doesn't make sense to do that. But yes, PCOS is one of those conditions that may not be completely reversible for everybody, but there's certainly a lot that we can do to try and manage some of those unwanted and annoying symptoms.
Just going back to insulin and its role in the insulin resistance, and we're talking about blood sugar. We should clarify we're talking about blood glucose.
Yes.
Because when we have sugar, especially table sugar, we've got half glucose and half fructose, and that's going in a different direction, which we'll get to.
Yeah.
But I think what's helpful is to understand how the body manages the energy. So with sugar, for example, when you metabolize it and you raise the blood sugar, your body removes the sugar from the blood, the glucose from the blood, also because over a certain level it's toxic, right? So it's treated almost like a poison to remove it from the bloodstream, to get it out, so can get it into cells for energy or into glycogen for storage, or then into fat if your glycogen is full and your cells are full. Because is that not insulin resistance when the cells are full and they say, hey, we don't need any more glucose. We've got enough.
Yeah.
So the door's closed.
Timed out.
Yeah.
Yeah. Like, and I think that an interesting thing that you mentioned about when we think about that switching off is that that speaks back to the that bubble gum in the lock that we were referring to earlier, and how that can potentially and really that's the imbalance, right? That's taking place is that the body, as you said earlier, the body doesn't make things or doesn't do things for no reason.
Yeah.
A lot of the time, we kind of think that things are innately bad. Like we were talking about cholesterol earlier, and really, it's the body's actually trying to protect you.
Yes.
And the defense mechanisms that are in place in order to do that can sometimes be misinterpreted as, like the body's doing something wrong.
Yes, yes.
But it's actually really, the things that are in place to make sure it's like, like a trapdoor, like a backup safety mechanism, and really unpacking that and understanding that how we actually, how we think about, the choices that we're making can potentially cause the body to shift out of balance. But really, it's about a protection.
Let's talk about how insulin resistance can precede type 2 diabetes, because I think, like you said earlier, patients will say, but my blood sugar is normal, but they don't realize they may be insulin resistant or have been insulin resistant for some time. So maybe walk us through that process.
Yeah, so we went through what happens, when you are ingesting sugars and refined carbohydrates, and how your blood glucose is impacted as a result of that. But what happens over time with diabetes and developing diabetes is that that insulin response, because your body is not responding to the insulin that's there already, what happens is that your pancreas now starts to burn out. And those cells in your pancreas that would have been producing insulin kind of get exhausted with with producing too much insulin that's actually not effective. And so the other thing that takes place in diabetes is just this chronic underlying inflammation. And this is, the combination of that high insulin level and, not being able to effectively control the blood sugar, feeding back to the pancreas saying you've made enough insulin. Eventually that pancreas starts to burn out and doesn't produce insulin anymore. Now, when we are diagnosing type 2 diabetes, usually what's happening is that in the beginning, you may still be producing low levels of insulin, but you're not as effective at producing enough and good quality insulin. And so the medication that we often use is really designed to improve your insulin sensitivity. And so typically, people will be prescribed medications like metformin or glucophage, and really that's to try and support the cells to become more sensitive to insulin. And so oftentimes people with type 2 diabetes, especially when we're first diagnosing them, what's happening is that we're really trying to salvage what's left of their pancreas to try and promote insulin sensitivity. But eventually what can potentially happen is that you're at a point where now you're actually not sensitive to insulin anymore. Even, those receptors to insulin are not actually doing what they are supposed to be doing. And people with type 2 diabetes can eventually require insulin injections or become insulin dependent. And the one of the challenges with insulin, in people with type 2 diabetes is that, again, as we said, it can even disturb the metabolism and cause weight gain. And so this interplay between inflammation, fat accumulation, insulin resistance really puts people with diabetes at risk for damage to the the endothelium, the inside of the blood vessels, as well as the nerve cells, which can become inflamed. And so when we think about, some of the potential complications of type 2 diabetes, we usually see these manifestations happening in the small blood vessels. So in the blood vessels in the eyes, in the kidneys, and, people will often complain of things like a loss of vision, but also increased risk of heart disease, increased risk of, fat, problems with your fat metabolism. And really we see this low-grade underlying chronic inflammatory process that's really causing some of the potential long-term complications of diabetes. And so when it comes to, even supporting people who may be experiencing, insulin resistance, or maybe they've just been diagnosed with type 2 diabetes, it is important to note that, even if you are at that point, there are a lot of things that you can potentially be doing to help to support your body, and potentially reverse some of those manifestations of type 2 diabetes. And I do feel like sometimes, people who are diagnosed with type 2 diabetes can feel like, I'm just going to deal with this for the rest of my life, because you're told by your doctor you're going to be on this medication, and it's chronic medication, and you can't actually reverse type 2 diabetes. I was in a conference, and they were talking about that exact thing, that you should never tell patients that they can reverse diabetes, because it's not possible.
So do you put your hand up and say, but?
I literally was sitting on my hands and thinking,
wait.
And in fact, I have a good friend who recently, went to his GP, was, diagnosed. His blood sugar was, I believe, 14, and he was put on not only, medication for the diabetes, he was put on 2 agents for his blood pressure, and he was put on a statin.
Statin as well, yeah.
And, he's in his early 40s, and he panicked. But ultimately, he's managed to put that prescription aside, take drastic action. And that's the thing that people, I was actually talking about this this week. We've become so accustomed to just taking medication to manage symptoms that we underestimate the power of lifestyle changes, and we don't give ourselves. The other problem with lifestyle changes is that it takes time and it takes commitment, and sometimes people feel like it's too hard to commit to that journey, but it is possible. And especially when it comes to the potential side effects of some of this chronic medication. Yes. And the other thing that we don't have a lot of data about is the use of multiple chronic medications together. What is that producing? A
lot of side effects.
Yeah, there was a time where I was in private practice, and I would see people coming in with prescriptions, 2 pages of prescription drugs. And when I, was really looking at it, it was so alarming, because I felt like, this, there has to be a better way. And then a rep came in and was telling me about these products that they had just launched that were supposedly to help with the side effects of the medication that they were producing. Yeah. And I was just like, this is too far. This is too much, And we really, and that's not to say that there's no place for medication, okay? So I'm not anti-medication. And I think that, when it comes to acute illness and when it comes to injuries and when it comes to like surgical procedures, modern medicine is fantastic, okay? We've made some incredible advances and we really have like come a long way. And if I were like, God forbid, in an accident or something and I needed to go to the hospital for some surgery, like that's what I want to do. But when it comes to chronic illness, I do think that we could be doing so much better. And, even if it is in the beginning, especially we find that like some people may have been on medication for a long time and they want to like, reduce the amount of medication. It's a foreign concept really in with most doctors because we usually add, we don't remove. But this idea that we could actually support even patients who have been on chronic medications, multiple chronic medications for a long time, we can actually support them through that process of actually making those lifestyle changes to reduce their dependence on these chronic medications. And maybe even get to a place where we're able to wean them off and even stop certain medications because they may not actually be required anymore.
Because these chronic diseases, like we termed them earlier, these diseases of civilization, didn't exist a few hundred years ago, or even 100 years ago. And they've manifested because of lifestyle changes, industrial processes, and so on. And we could go a long way to reduce the effects just by making interventions. But I think we're such slaves to convenience, we would rather take a pill than make changes to our lifestyles.
Yes. And I do think that, when we look at civilization before, yes, of course, it was a completely different world. The amount of like just environmental stress that we experience today was nothing compared to like what existed before. But I do think that when we look at how civilizations functioned back in the day, there was this deep interconnectedness with nature. And I think the further away we move from nature, the more diseased we become. And the idea that not only going back into nature, because we do live, in a concrete jungle, and we really are not getting out into nature as we used to before. But when we look at plants, and even looking at plant-based medicines, and some of the alternative medicine or the alternative practices that were there long before modern medicine came to be what it is today, maybe people were using more like supplements and herbs and nutrients that they were able to get from the environment to support them. And even if they were placed under, extreme stress or whatever and would have manifested a disease, they were able to manage the symptoms that they may have been experiencing without the potential side effects. I do think that, if you look at how we actually came to be in this position that we are in today with pharmaceuticals and modern medicine, the one of the main problems that was experienced was uncertainty around dosing, uncertainty around being able to reproduce plant-based medicines in a way that was going to produce the same effect every time you gave it. And so, when we made pills, we were able to like really, narrow that down and focus on like, okay, this, we know the effect that this medication is going to have and the potential side effects. But with plants, you could have one plant of ginger and another plant, and it could be completely different. And so with botanicals, it's really like this wider, range of effects. It's a lot more like intuitive, I guess, when you're using plant-based medicines versus pharmaceuticals. And that was for a long time looked down upon and was seen as like non-scientific, and also was seen as, not reproducible. And so, of course, for a lot of botanical medicines, the science and the research just wasn't poured into those things because it wasn't going to be something that could be, widely prescribed. But I do think that now we're starting to turn back that way.
Yes.
Now that we realize that, okay, hang on, there may be a place for pharmaceuticals, but it's not necessarily the only thing that applies. Now we have the ability to go back and look at some plant-based medicines and see like, okay, so maybe we can now do more research, and we can get a little bit more specific about dosaging, and we can get a little bit more, focused on like, how do we utilize plant medicines to support our health, minimize the negative side effects that we could be dealing with, and start to incorporate both botanicals. And then I always think that like pharmaceuticals should be like an option if you've exhausted other options, and as long as it's safe to do so. You don't obviously want somebody who is like experiencing diabetic ketoacidosis, and then you're like, okay, let's look at plant medicines. However, I do feel like when it comes to addressing diet and lifestyle, and incorporating herbs and botanicals and plants that have a similar effect to some of the pharmaceuticals we use, but also managing the negative side effects that could potentially come with using a pharmaceutical, we need to now start to be a bit more open to that as part of the plan when it comes to managing chronic illness.
Yeah, I think you also have drug companies that will be looking into the botanicals, because many pharmaceuticals are rooted in plant-based extracts anyway, right? Like I think your opioids all come from the poppy.
Yes. Even some chemotherapy agents, plant-based. Aspirin comes from there's what modern medicine has really done is it's taken those components of the plant, they've isolated it, they've concentrated the effect, and then they've synthesized it, right? But when you're using botanicals, you're actually getting a spectrum, because you actually are using the plant in its whole form. And so the approach is different. And I feel like, when it comes to the pros and cons of pharmaceuticals versus botanicals, I do think in certain instances it's wise to concentrate and to focus and to be narrow in your therapeutic effect. But in other instances, getting the full benefit of the whole plant would go a far longer way for promoting wellness. And so how can we interplay, and how can we, balance the use of both? I think in future that's going to be something that more and more doctors start looking into, I hope, at least.
One would hope so.
Yeah.
Are there plants and botanicals that you would indicate for insulin resistance?
Yes, so berberine is a great one. It's actually, very similar in its effect to metformin. And in fact can potentially even be dosed the same way, like a 1:1 basically. But it does pretty much the same thing in increasing insulin sensitivity and can help to stabilize blood sugar even, but also help with insulin resistance. Myo-inositol is also another great option, especially I use it a lot in women with PCOS. It's actually not only myo-inositol, it's also dechiroinositol, but they have to be in a ratio of 40:1, which is the ideal physiological ratio. And that also is fantastic for reducing insulin resistance. There are a number of anti-inflammatories that also can be very helpful in people who are dealing with insulin resistance. Things like curcumin. Curcumin also great for even reducing or helping to manage imbalances in your blood lipid profile.
That's turmeric, right?
Curcumin, the active ingredient in turmeric.
Okay.
Yes. If you are going to be using turmeric, though, it's important to pair it up with black pepper, just to make sure that you are optimizing the bioavailability. But yes, great addition to your food, even just smoothies or even just like a golden milk. But for those people who really want to like use it for managing their blood lipid profile, but also managing inflammation, then you could get a curcumin extract or supplement to use as well. I think that even things like magnesium, it's so important for us to be topping up on magnesium, especially, using something like magnesium glycinate, for example. Great for anti-inflammatory, great for supporting your cells, for doing all the things that they need to do, supporting your mitochondria, I think, when it comes to insulin resistance, of course, all of those supplements, yes, but coupled with good, changes in your
lifestyle
food choices, lifestyle, and stress. I think that stress is also something that we often don't look at when it comes to our hormone balance and cortisol, and the impact that stress can have on us as human beings is so vast. And like some people will say like, I'll ask them about their stress levels and they say, oh no, I'm not that stressed, but they've had some kind of traumatic childhood experience or thing that's happened in their past, and they haven't actually like unpacked and dealt with that. And they say the body never forgets. It's sitting somewhere in your subconscious mind, and it's still exerting its effects. And so, whether it is things like stress management and optimizing sleep and supplementing and removing those endocrine disrupting chemicals, moving, exercising. I know sometimes when you speak about exercise, it's important, like people get like, I don't like to exercise, or
maybe, but I think people also don't understand those internal benefits of exercise, because we know we should do it because everyone tells us to do it.
Yes.
But exercise makes you more insulin sensitive, right? So like the hormonal benefits of exercise are not well understood by the general population.
And also it's aside from improving your insulin sensitivity, it also helps you to manage and process stress. And if you think about like the fact that we live in such a stressful world, and life is so stressful for so many of us, what are we actually doing with that stress that's building up inside of us? A lot of the time, it's kind of just sitting there. Whereas if you move your body and if you are doing some kind of exercise, it can really help you to process and to even get better sleep.
Yes.
And we spoke about like how when you haven't had good sleep, your ghrelin and leptin goes out of whack, and that can trigger cravings, which can cause you to eat more sugar, which can influence your insulin resistance. So all these things working together to actually help to support people who have chronic illness. But even if you don't have a chronic illness, because a lot of the time people will feel like, oh, it's not for me because I don't have anything wrong with me. But I think we all could even make small changes or like adjustments to our lifestyles that could benefit us in the long run. Yeah.
There are two things I just was thinking of because you mentioned leptin again, and earlier we spoke about patients that have difficulty losing weight. And maybe important factor to highlight is that with insulin resistance, when you have elevated levels of insulin, you can't oxidize the fat because insulin blocks hormone sensitive lipase, and it also blocks your leptin signaling. So you feel hungry,
Yes.
you're eating more, and you can't access your energy stores, your fat energy stores.
And a lot of the time, the complaint will be, people will say, "I've just eaten, and I'm hungry again."
Yeah.
It's like a strange thing, to experience. But as you're saying, on a molecular level, this is actually what's happening. That's driving that appetite, because your body thinks it's starving.
Yeah.
It really thinks that
And you have
not,
energy stores.
Yeah. You're not. There's not enough, so we need more. But actually, it comes down to how we're actually utilizing what we already have.
Maybe also for people to understand that leptin is your satiety hormone, but it's secreted by your fat.
Yeah.
So that's part of your energy storage. You have the fat, your body's telling you, I have enough energy now, I'm full, don't eat. So it secretes this leptin, but that's blocked by insulin, right?
Yeah. And so, a lot of the time people will say, I want to lose fat, or they'll want to do like cosmetics, procedures to have fat removed, thinking fat is just fat.
Yes.
But it's metabolically
it's active. Yeah.
And when we start to see really what your fat is up to and what it's doing, then it becomes even more important to think about, okay, so now, how can I potentially optimize my body to reduce some of the things that are even happening inside my fat cells.
Something that I think is quite important to talk about is the rise in fatty liver disease, non-alcoholic fatty liver disease, because there is interplay with insulin resistance. But what's of concern is this is happening with kids. So maybe you can give us some insights?
So non-alcoholic fatty liver disease is definitely a concerning issue on the rise, and links back to how our bodies actually, or what our bodies do with fructose. And really, fructose is something that it's so normal for us to drink, for example, sugary drinks, and not realize how that is actually going to affect the way our liver, what our liver is actually going to do with that fructose sugar. But essentially, what's happening is that, and another thing that's important to note about that is that when we are drinking a fructose, again, it actually makes us hungrier, and it actually causes us to eat more. And so we think, and another thing there is that it's important for us to note that when we're drinking highly sugary beverages, what's often happening also is that the salt content in there is actually causing us to be more thirsty, causing us to drink more. And it's actually dehydrating us in the process. And that, fat, or that fructose that's eventually landing up in the liver is now being stored there, and congesting the liver and contributing to fat accumulation inside the liver. And so when we think about how or our relationship with sugar, not only are we seeing that we are consuming sugar because of the drive or the desire for feeling good, but it's actually addicting, and it's actually driving us to drink more and to consume more. And so, non-alcoholic fatty liver disease is definitely cause for concern, because it can be a precursor to cirrhosis in the liver. And the liver is such an important detoxifying organ, doing so much with regards to even our hormone health and balance. And when our liver cells are surrounded by these fat accumulations, it can ultimately lead to dysfunction in the way our liver is actually able to process and bring about balance, and to clear things like estrogen, and to metabolize our medications, or even supplements that we're taking in, to control our production of things like LDL cholesterol, which has gotten such a bad name and such a bad rap. And really, reducing the liver's ability to just function optimally. And so it's a difficult thing, because, having like a soda on the table, at a meal. Sometimes people are drinking like 2 liters of soda a day. And again, not having a problem with your blood sugar level, and thinking that, there's no effect.
Because fructose doesn't spike your blood glucose.
Exactly. However, we're seeing, this on imaging, that people are actually presenting with manifestations of excess fructose consumption on scans of the liver, without even realizing that this is happening to them. And so it's one of those unseen diseases, similar to things like hypertension, right? The silent killers that are kind of happening in the background. But certainly, becoming more and more common, and again, because of the world that we live in, just kind of supporting those.
I think they do say that most people that have fatty liver disease are unaware of it. And it's happening with kids, with sodas and fruit juices.
That's another thing. People think that fruit juice is so healthy. And a common thing that we speak about, especially when we're talking about PCOS and managing insulin resistance, people often ask me, well, what about fruit? Can I have fruit? Because fructose, fruit sugar. And really, if you think about something like apple juice, how many apples is it going to take to produce? Firstly, that apple juice that we all think is apple juice. If you actually juice apples, it doesn't look like that. So it's clearly not just pure apple juice. But even if it were to be pure apple juice, like how many apples do you have to juice in order to get a cup of apple juice? And let's say it's 4 apples. Can you sit and eat 4 apples, at a time? No, you can't. And that's because of the fiber, because of the water in the apple. And so it's far better to be eating whole foods versus foods that have been foods that have been so processed, because you really, similar to, I guess, pharmaceutical medications, is that you're taking nature and you're concentrating one component of it. You're going to end up in trouble. And this is also something that I talk a lot about, when I speak to people about cannabis. I think we'll get to that. But again, extracting, I don't know if we should talk about this yet, but when you look at the shelves nowadays, in your health shops and that kind of thing, you see people, all sorts of brands of CBD, and people think that, if I take this, it's going to help with all these things, because I've heard such wonderful things about CBD. What they're not realizing is that what they're taking is an isolate of the cannabis plant. And it's not the same thing as if you're taking a full plant extraction. And so I suppose this recurring theme of the whole is bitter than
Yeah.
the sum of its parts, I guess.
I think with fructose, the danger of it is in the prevalence, because with corn syrup, high fructose corn syrup, it's in everything, every processed food. So it's not just in the juices and the cool drinks, but it's in the cookies, it's in the cakes, it's in salad dressing, it's in everything. Even what appears to be innocuous can have corn syrup in it, and it's just does so much damage that we're completely unaware of. I read a statistic in one of these studies that for every glass of soft drink or fruit juice that kids have when it's enriched with corn syrup, it increases the likelihood of adult obesity by 600% each serving. It's frightening. It
is. And I suppose even to that, oftentimes we were talking earlier about ADD, and I guess, speaking broadly, I suppose, about how sugar and insulin resistance can affect the brain and cognitive function, oftentimes manifesting as this hyperactivity. And a lot of time people will be hesitant to look at things like diet and its influence on behavior of children. And sometimes making those changes, even the preservatives, that are in these foods, can sometimes be hyperstimulating and be causing these behavioral disturbances. And we may not even realize, as you're saying, the impact of some of the foods that are commonplace, that we've just become so used to.
So desensitized.
Yeah, it's just like, and I see there's this movement now, the What's in Our Food. I don't know if you've seen, there's this, I think it's a petition, but I know I've seen like variations of this in other countries, but this group basically advocating for warning labels on our food.
I have seen this.
And I think that is so important, because here, like, the thing about it is that we look at food and we don't think that it's dangerous, or we don't see how it could be potentially dangerous. And part of that is, the way we've just been socialized, but also the producers of this food have a lot to answer for with regards to, well, how are you labeling this food? Yeah. And how truthful are you being about what actually is inside this food? Yeah. And more than that, what is this food potentially going to do to the end user?
I mean, when we were kids, what we thought was healthy, we were eating sugar, all day long. Yeah. I mean, you have Milo before bed. Yeah. It's sugar. Why not? Sugar and malt. And we thought
oftentimes put sugar in the Milo.
Yeah.
And so yes, I do think that some kind of that manufacturers of food and manufacturers of products in general should be a lot more accountable for what they are making available to the general public for consumption. And a lot of the time, the onus is put on the consumer to do the research.
Yeah, it's always.
It's like, but it was your choice to spend your money to purchase this particular item. And so what research did you do before you actually did that?
But they also proliferate the media with misinformation. Yeah. So if you do your research, you're not getting the right reflection of what's happening.
Yeah, that's it. And the greenwashing oftentimes that happens, or like the health labels that oftentimes go on these foods that make you think.
Fat-free, low GI.
Like low GI, and speaking about like things like Milo and cereals, how it's marketed to kids. I saw this interesting thing on, I can't even remember where, but they were looking at the front box of cereal, cereal boxes, and how the characters are always like making eye contact.
Yeah. And the color.
Yeah. So it's attractive to kids. The characters are looking at the kids.
Yes.
And, it's so like, that's really, that's really bad, And yeah, marketing to children who really cannot make decisions for themselves. And it can really be confusing for people who want to do the right thing. They want to make good purchasing decisions. But as you're saying, even sometimes when you do your research, you can find conflicting information out there.
All right. Back to our hormones, which is like a really exciting topic. But I think what we may have glossed over that people would find quite fascinating is that your sex hormones, let's call them sex hormones, estrogen and progesterone and testosterone. Well, let's put it this way. Your progesterone and your estrogen are formed from testosterone, and your testosterone is created from cholesterol.
Yes.
So this brings us to this very important topic of how we need cholesterol for all our hormones.
Yeah. So cholesterol has gotten a very bad reputation. Just because I think we've misunderstood really how an imbalance, and specifically the small type of LDL is actually the problem. We can maybe get to that just now. But a lot of times people will say like, oh, my cholesterol's high, and I need to be on medication for it. And so people have this idea and this connotation that cholesterol is a bad thing, and that it needs to be controlled. But we said even earlier that the body doesn't make unnecessary things. And I even think about this when it comes to organs. Sometimes, people will rush to remove their tonsils and remove the gallbladder and remove, those things are there for a reason. And when we understand what they're doing and how they should be operating in balance, that's when we can get a deeper understanding about how important they are. So cholesterol is super important. Every single cell in our body needs cholesterol to even exist. So yes, cholesterol plays a vital role in producing our hormones, producing vitamin D. But also we need cholesterol to digest our food because it produces our bile salts. So when we think about the fact that our hormones even originate from cholesterol, it's so important for us to then look back and say, okay, well, hang on. If cholesterol is so important, then why are we trying to shove our cholesterol down so much? And why are so many people being put on statin drugs in order to do that? And like we said earlier, we were trained in that knowledge that, HDL cholesterol is good, LDL cholesterol is bad. And we've got very fixated on the numbers. When you look at the lipogram, so the blood test that tells us about your blood lipid profile, we get very tied down into making sure that we want high HDL cholesterol and low LDL cholesterol. But LDL cholesterol is really not bad in and of itself by its nature. We need it in order to control our fat metabolism. It's going in and out of the liver, carrying cholesterol. We need it to produce hormones and things like that. So what's actually the problem is when that LDL cholesterol becomes oxidized. Oxidation is a normal part of life. It's happening all the time. It's however, we need to repair some of the damage that happens with oxidation. But really, what's driving that oxidation of that LDL cholesterol is inflammation and insulin resistance. And so essentially what's happening is that the shape or the size of that LDL cholesterol changes from like a light, fluffy situation to like a small, hard, dense. And the problem there is that when that, dense molecule starts to dominate, it actually can't fit into the receptors on the surface of the liver and can't be utilized for cholesterol transport. But also it starts to now bash into the inner lining of our blood vessels, and then starts to seep underneath that intima layer, and that accumulate. And when it gets there, your body's immune system is like, we've got LDL cholesterol in the wrong place. We now need to like wall off this cholesterol. And so the cells of your immune system now, kick into gear, and they start like surrounding this LDL and like cutting it off from the rest of your body. And they eventually build up and produce this plaque. And so the problem really is that small type of oxidized LDL cholesterol, not LDL in and of itself. The problem is defining or taking a closer look at like, okay, so how do we know the difference between those different types of cholesterol? And there are some tests that can be done, but it's important to know that if you are in a inflamed state, like a chronic inflammation state. I think inflammation is another one of those things that gets a bad rap, because we need inflammation, right? Inflammation is what protects us from invading organisms and foreign objects. But when we have chronic, ongoing, long-term inflammation, that's what actually is going to feed into disease. And that, coupled with insulin resistance, is going to also increase your likelihood of getting more of that bad type of LDL cholesterol. And so what the statins are doing is that they are then blocking the ability of your body to produce that cholesterol, and so your liver is going to upregulate the receptors to try and grab onto more of that LDL. So your LDL will go down, but it's going to reduce the good LDL that you actually need for transporting cholesterol. And so it's not actually going to affect that small, dense type of LDL cholesterol that's actually responsible for putting you at risk of heart disease. And the other thing that statin medications do is that they interrupt your ability to produce CoQ10. And, CoQ10 is a great antioxidant, but it also is responsible for your energy. And so oftentimes people, again, they're prescribed statins for with good intention, but oftentimes people on statin drugs will complain of things like muscle pain and fatigue in their muscles. They'll generally feel tired and lower energy levels, brain fog, because of course your brain needs energy, and if you're not, if you're interrupting CoQ10 production, your brain is not going to be as fueled as it needs to be. And interestingly, you're also going to rob your heart of the energy it needs. And so we're trying to reduce cholesterol, but actually we should be focusing on the inflammation and the insulin resistance, and focusing less on the numbers that we see. One of the principles that I learned is, you treat the person, you don't treat the test. And so again, it comes back to really understanding that at the root of most chronic illness, you'll find inflammation, insulin resistance. And if we just tried to focus on addressing those issues, we can actually go a very, very long way.
Yeah, I think with cholesterol, it's really interesting because I think there were major studies. There was a Minnesota coronary experiment and the Sydney heart study and LA veteran study and so on. And they did these experiments where they lowered the cholesterol in certain groups and they revealed certain findings, but they also withheld certain findings. And the one that I think was really important was that in the groups that they lowered cholesterol, they had higher all-cause mortality, much higher all-cause mortality. So dying younger with lowered cholesterol is not a desirable outcome, right?
Yeah, it's so true. And you're speaking about like withholding all the information. It's a recurring theme that we see, unfortunately. You know, when you follow the money and when you really look at like who's funding these studies, not to be like a conspiracy theorist, but a lot of the time the findings are manipulated. I mean, if you think about drug companies and, you know, what it takes to actually produce new medications, there's a lot of money that has to go into that. Research, development, you know, a lot of people need to get paid in that process. And so ultimately, if you have achieved, you know, you've developed a medication, you now need to recoup some of those, costs. And if there are findings within the trials that could potentially reduce how these medications are utilized and prescribed and rolled out, then it's not in your business interest to actually release those findings. And again, this speaks to like the commercialization of healthcare. It's actually sick care, you know, and the shift that we've seen, along with, you know, the advances in modern medicine towards driving profits rather than outcomes. And this doesn't, again, mean, you know, that all medication is bad. It just means that when it comes to taking agency for your healthcare, it's so important for us to realize that maybe even if it's not specifically like your doctor, the system that your doctor is potentially working in could be problematic. And so ask questions, like understand things. I always encourage people to not just rely on what they're being told, and just kind of follow blindly. And I do think that there is starting to be a shift. I think that like people are having more access to information. They're doing their own research. They're experimenting on themselves.
That should be encouraged, right?
Absolutely. And it has never been encouraged in medicine because of the way we viewed, alternative practices, but also the way we, I think, sometimes can get wrapped up in I'm the doctor, I know best, and you are the patient, you should follow my advice. I've heard like horror stories of people who have wanted to go like a more holistic route and, look at their options and just, not rush into treatments, and doctors just like completely refusing to see them anymore. And just like, if that's your choice, then, hopefully that does shift in future. But I do think that, healthcare and the wellness of people, it should be a collaborative effort. We should be working with people. Like, there's no way that we can know everything, or like take the position that, what we know is the right thing. Because there's so many things that, with time we're realizing, oh, hang on, it's not as we thought it was. yes, so I do think that that having a voice and being confident in getting a second opinion sometimes is also something that should be encouraged.
Statins are one of these drugs, for example, where it's quite possible that the risks outweigh any potential benefits, because two of the big side effects that definitely have relevance to our discussion is that they can cause insulin resistance and diabetes.
And they're often prescribed in people who have diabetes or hypertension. And, when we're talking about metabolic syndrome and how these things can all kind of, occur together. And again, speaking about our discussion about using birth control in PCOS, really understanding that the cure can sometimes be the cause, and really, I think our reliance on medication as the end of the road. I've been prescribed this medication, I'm just going to take it for life and that's it. I mean, even some of the medications that we've been using for years, we're seeing that they can, for hypertension, for example, can increase your risk of certain cancers. Like, we just don't, there's no way to have all the answers, up front. That's just not how knowledge accumulates. It accumulates over time. And if you haven't utilized a medication for long enough, and certainly if you haven't used it in people who are perhaps on multiple medications at the same time, it's very difficult to know what the long-term effects of those medications will be. And only time will tell. And by that time, it's sometimes too late.
Too late.
Yeah. So I do think that when it comes to making those choices and to deciding, you want to be safe. So you don't want to do something that could potentially threaten your life right now. But oftentimes, when it comes to, these lifestyle disorders or diseases, there's time to work on it and to take the lifestyle steps necessary to start to see a change. And maybe it's not going to be as quick as it would have been if you took the medication. However, again, the risks, the benefits. I feel the same way about birth control. We just prescribe birth control across the board for all kinds of everything. Heavy period birth control, painful period birth control, PCOS birth control, acne birth control. Endometriosis, everything gets birth control. I don't have my period, birth control.
Do you think this direction comes from the drug companies?
And how they market it to. Medications are heavily marketed to doctors. Heavily. Aside from doing pharmacology at medical school and that kind of thing, and learning about, how medications work, pharmaceutical companies do a lot to market their medications to doctors. Whether that is, it's less pervasive, I suppose it's more subtle now than it used to be. But, pharmaceutical reps see doctors all the time. They host events all the time. They, they'll leave a pen with the name of their company, or it's programming. And another thing that happens, it happens a lot in the States. I remember when I used to work on the ship and I used to get the television programs that were in the States, I was shocked. But direct-to-consumer advertising is a huge deal there. Here we advertise over-the-counter medications, again, medicalizing, the human condition. If you have pain, you should take a painkiller over the counter, and just advertising the benefits of, the person's sad and they have pain, and then, now they're happy because they don't have pain. And what is the difference? Oh, it's the pill. But in the States, they advertise even prescription medications.
Yeah.
And sometimes even like will reference their competitors inside the advertise and the advert, and say, like, if you are on this medication, then you could be experiencing these side effects. You need to see this lawyer or whatever, and claim for your damages or whatever the case may be. Or like, instead of using this medication, use ours, and then, because it's better for XYZ reasons, and then like towards the end of the advert, side effects may include, It's like, but again, like, it's programming, like it's putting it in your subconscious mind. It's like thinking, it works. It works. And yes, I do think that, the bottom line for these companies is profit. And I do think that as long as they get, doctors and health professionals to prescribe or suggest this medication, they stay in business.
Yeah, they keep their market share.
Again, not to say like all medication is bad, but I do think that, we're veering away from like what's in the best interest of the person and what's in the interest of wellness, and our vision may have been very clouded along the way.
I think definitely there are good medicines and there are bad medicines, but as long as there's a profit incentive and shareholders to satisfy, then there are going to be concerning things that come up. I think if you Google the top 5 criminal fines in history, do it as an exercise, just see what comes up.
Okay.
Yeah. I'll leave the surprise up.
Thank you.
For you. Let's move into cannabis and talk about how you got into that field.
So the doctor that I told you about earlier, who introduced me to cannabis and gave me the stuff, the articles to read, really is what set me on my path to really like looking a little bit closer at this plant. And then from there, I just started, doing courses and studying and just looking more into the potential benefits of the cannabis plant. But one of the things that I was fascinated to discover when I was researching cannabis was about the endocannabinoid system, which I didn't learn about at medical school. And I couldn't actually believe that there was just like no education around it. And so the endocannabinoid system is this like regulatory system that kind of oversees all the other systems in our body. And the role of the endocannabinoid system is really to bring balance, homeostasis in the body. And what I learned was that, we all have an endocannabinoid system and we all produce our own endocannabinoids. And for a long time, you mentioned opium, and for a long time, substances like opium and, morphine, and, we understood how they actually exert their effects on the body. But for a long time, we didn't know how cannabis was exerting its effects on the body. And then Prof. Mashalom started looking at this in his lab, and he's really like the godfather of cannabis medicines, and discovered, together with some other young scientists in his lab, the 2 main cannabinoids in cannabis, CBD and THC. And then eventually discovered that actually we have receptors inside our bodies for these two plant-based cannabinoids. But then he was like, hang on, the body is not going to make receptors for plants. There has to be some kind of, endogenous chemical that we're producing, and that's when they discovered anandamide and 2-AG. Now, anandamide, ananda is the Sanskrit word for bliss, so it's also known as the bliss molecule, and it's a virtual mirror image of THC. And then 2-AG, again, mirror image of CBD. And so then they started looking into, well, okay, so how do these chemicals actually work in the body? And really the receptors of the endocannabinoid system are concentrated mostly in the nervous system and in the immune system. So you get CB1 and CB2 receptors. Mostly CB1 receptors are in the brain and the nervous system, and mostly CB2 receptors are in the periphery, but there's some organs where you can actually get both receptors. And essentially what these receptors and anandamide and 2-AG are doing is that they're exerting their effects on the nervous system and the immune system to regulate them and keep them in check and keep them in balance. And so when we think about, how we use cannabis as medicine, this is really the two main areas where we see like the most effect or the most benefit in utilizing cannabis is, neurological conditions, things like epilepsy, pain conditions, anxiety, neurodegenerative disease, MS, and then together with immune system disorders, any inflammatory condition, basically. And really what we're trying to do is that we're trying to optimize, support, and also supplement the function of the endocannabinoid system in order to manage that either over or understimulation of the nervous system or the immune system. And so we were talking, about, botanicals and the difference in that broad spectrum versus pharmaceuticals. And really what we know about the cannabis plant is that it's not just CBD and THC in the plant that are so amazing. There's over 100 different, cannabinoids in the cannabis plant, but also we see that components like, flavonoids of the plant, terpenes in the plant, all of these things work together to actually produce different effects. And interestingly, when we look at terpenes, the terpene profile of a plant can actually be optimized for different conditions. So for example, people who maybe are having trouble sleeping, a cannabis plant that has high linalool. Linalool is the terpene found in lavender.
Yes. And
we know that helps to sedate and to calm down and to get better sleep. So the terpene profile, the cannabinoid profile, the extraction process used for the product that you're prescribing, all of these can influence how the plant can potentially help a person who is looking to cannabis to support their health and wellness. Of course, cannabis has got a bad reputation because of partly what we've been told, but also partly because when we look at the recreational use of cannabis, it's very different to the medicinal use of cannabis. Not to say that the recreational use of cannabis is a bad thing. However, what often happens is that the plant has been hybridized and, selected to produce higher THC. And also when you burn the cannabis plant, you're actually concentrating the THC. And so this is what potentially may result in negative effects for some people. Again, we all interact with the plant differently. And it also depends where the THC attaches in the brain, what effects it's going to produce. But certainly when we're using cannabis for medicinal purposes, what's important is that we are ensuring that the plant that we're using is appropriate for what we're trying to manage, but also that we're using high quality products, and also that we are using the full plant extraction versus, isolates, and also that there's some kind of reproducibility. So what'll happen with cannabis medicines and producing medical cannabis is that there has to be some kind of third-party testing to make sure that there's no contaminants in the products. Sometimes when we're extracting from plants, you can use like solvents that can sometimes remain in your product. And you, of course, don't want people to be trying to achieve health and wellness and then consuming a product that's laced with all these solvents, but also things like pesticides, herbicides, fungicides.
So those are also endocrine disruptors.
Correct, that may find themselves in these products because of the way the plant was farmed. So we really need to look at what's known as the certificate of analysis. When you're purchasing cannabis recreationally, there's no way to know what's in there. What has it been mixed with? What's the quality of the plant? Is there mold growing in there? What's the cannabinoids that are in here? Versus when we're using cannabis as medicine, it's slightly more controlled, but for good reason, because we want to be able to know for sure that we're prescribing a safe product, but also that we understand the individual components of the plant so that we can make informed decisions when prescribing.
So what kind of conditions are you treating?
So in South Africa, the way medical cannabis is prescribed is that we have to use a Section 21 application. So a doctor has to prescribe the cannabis. You have to submit an application to SAPRA and then get approval. And so there's a very small range of conditions that we are able to prescribe cannabis for at the moment that SAPRA will get approval for. Some of them include pain conditions, so chronic pain, neuralgias, fibromyalgia. Insomnia, interestingly, is something that we often prescribe medical cannabis for, and it's just recently been approved. Anxiety, we're getting approvals for anxiety. Interestingly, endometriosis, because it qualifies as a chronic pain condition, so that's very helpful for people who experience chronic pelvic pain as a result of endometriosis, epilepsy, and a lot of the inflammatory conditions. So anything that, produces chronic inflammation. So conditions like arthritis, potentially even inflammatory conditions of the gut. We are also prescribing for managing the symptoms, either directly related to or as a result of the treatment of cancer. So, the nausea and vomiting often that accompanies things like chemotherapy, we're able to prescribe for those conditions as well. And so a lot of the time what we have is people coming for these prescriptions because they've either never used cannabis before, or they've already started using cannabis medicines, but they need some kind of proof that they're on cannabis for medicinal purposes. Okay. And so it is becoming a lot easier nowadays to fulfill these prescriptions, but it is important for people to note that unfortunately, when it comes to the official SAPRA approval, we're still a little bit restricted with regards to what we can and cannot prescribe cannabis for.
If you prescribe cannabis in this way, what is the best way for patients to consume it?
So there's a variety of different products that SAPRA has approved for medical cannabis use. So part of the reason why there's this control that SAPRA has over the prescription is because they want to make sure that the products that are eventually getting into the patient's access are safe. So there are few ways of dispensing or prescribing cannabis, but at the moment what we have access to is the dried flower. But there, it's important to remember that we don't typically advise burning cannabis. Okay, of course, some people do still burn the pre-rolls or roll their own cannabis, but we usually suggest that they utilize a vaporizer rather than using the flower in the vaporizer to heat up the plant and release some of those oils versus burning the plant. However, people can do that. So dried flower and pre-rolls. And then we have tinctures that are placed under the tongue. The reason why we do that is because when you ingest cannabis, so people may have experimented with edibles, but when you ingest cannabis, it actually has to go via the digestive system, via the liver. And so the onset of action is a lot slower. And for people, for example, who have pain, they don't want to wait for 2 hours for pain relief. It's commonly the reason why people can take too much is because they feel like, oh, this is not working, let me take some more. And so putting it under the tongue, it gets absorbed directly into the bloodstream, skips the liver, and just has a much shorter onset of action. So that's another option. We also have capsules. I'm not a huge fan because of just, what I said, that, it can be a long while before the onset of action is experienced. So that's what we have at the moment with regards to the products that we have available from SAHPRA. However, if we look at the rest of the world, there are topical preparations of cannabis oils that can be utilized for even skin conditions, like inflammatory skin conditions and even pain conditions. And then others include things like suppositories. Now, not a popular way to administer cannabis, but very helpful in people who are in palliative care, and people who really just cannot tolerate, oral medications, or maybe difficult to dose for whatever reason. So, and then another interesting one is vaginal pessaries that we're seeing. In some parts of the world, they're using them for things like localized pain relief. So reducing inflammation directly in the pelvis by inserting a vaginal pessary. So those are the options that are available. It's just important to remember that, again, prescribed cannabis is very different from, what you're going to get. But also what you're going to get over the counter.
Yes.
I think that, a lot of people will reach out to me and say, oh yeah, but I tried that, it didn't work. I bought this oil or whatever, it didn't work. And a lot of the time it's got to do with the dose. So it's important to note that over the counter, CBD even, for example, can only go up to 20 milligrams a day, which is a minuscule dose, And so, the prescribed
people will take a lot more than
then they're going to run out of the bottle very quickly. And that's oftentimes what happens, is that they feel like, I used this whole thing and nothing happened. That doesn't mean that you couldn't, potentially use it as a supplement, because remember, whether you are trying to treat or manage a chronic condition, or just trying to be healthy, we all have an endocannabinoid system that could use some support.
So it would almost be like microdosing.
Correct, yes. And almost like a wellness thing versus a treatment thing. But it's also important to note that there are, what we call cannabinomimetic practices that help to support the endocannabinoid system that don't involve cannabis. coming back to, the food we eat, the exercise, the massage, the, stretching, the getting out into nature, the connection with others, the relationship building, managing our stress. So all of these things, sometimes people look to cannabis to be the thing, like the panacea, like it's going to be the thing that actually helps. But we have to look at it in the context of a holistic approach. And certainly utilize cannabis as part of a wellness journey, as opposed to just, focusing on the plant.
Yeah, I think one of the concerns, I suppose, is the addiction potential.
Yeah.
But I guess this is something with normal pharmaceuticals anyway. You've got an opioid crisis and addiction to anti-inflammatories.
So it's interesting when we look at that, because when we look at so we have to say that yes, there is potential to misuse cannabis. And there are some people who are going to develop a dependence on it. However, if you look at the potential for that abuse, cannabis ranks much more closely to coffee than it does to opioids. But what's interesting about people who are dependent on opioid medications is that for a long time we were taught that cannabis is a gateway drug, but we're actually seeing the reverse, that cannabis actually can act as an exit drug, helping us to get people who are dependent on opioid medications to reduce their doses and actually get off their medications. And it's you brought up anti-inflammatories as also being a bit of a contributing problem for a lot of people, some people don't even realize that that dependence on the anti-inflammatory is actually happening. Some people just take anti-inflammatories just
like Smarties.
Yeah. And really the potential, risk factors for that are huge. Aside from, bleeding ulcers and that kind of thing, increasing your risk for things like hypertension, heart disease. We have the option and the ability of, or to provide access to a botanical medicine that is far safer than a lot of the pharmaceuticals that a lot of people have been on.
Because there isn't the potential to overdose and die with cannabis. I mean, you can have a bad trip, but you can die when you overdose with opioids, for example. Correct. Yeah.
And that's, that the opioid crisis, speaking about pharmaceutical, marketing, and I watched the documentary Dope Sick.
I haven't seen that yet.
It is just a very interesting story of how, Purdue Pharma actually fueled the opioid pandemic in the States, just brainwashing essentially doctors to prescribe their opioid, telling them that it's not addictive. And really when it comes down to utilizing cannabis to get people off these opioid medications, it can be so helpful, even when it comes to medications like antidepressants. Might be controversial to say, but we shouldn't be prescribing antidepressants for long periods of time, and oftentimes, people have been on antidepressants, opioid medications, repeat prescriptions for these things. And we do have the opportunity to assist and help people to get the balance that they are seeking without the dependence on that. But coming back to your question about being able to overdose on cannabis, just because we don't have the receptors for cannabis in the parts of the brainstem that are responsible for controlling our respiratory centers, it's physically impossible to overdose on cannabis. Does that mean that if you had a bad trip and you made some irresponsible decisions and maybe drove a car, while
under the influence
or while intoxicated, then sure. But when it comes to the potential for overdosing and dying as a result of cannabis, that's partly why we see it as such a safe alternative to some of the medications that we know are linked to death and have been the cause of so much like just destruction and loss of productivity and loss of quality of life for so many people who have become dependent on those pharmaceutical drugs. Yeah.
When you talk about vaporizing, do you mean the device and you would put in the dry flower and it would heat it?
Correct.
So it's that process and not necessarily an oil that you vaporize, like a common vape.
Yes. So, yeah, at the moment we don't have, there are oils that are used in other parts of the world, but they are not the vape oils that people who vaporize would utilize. So at the moment we recommend that the preferred way of inhalational dosing would be to vaporize the dried flower. And the great thing about that is the onset of action. It's the quickest onset. Okay. And so people, for example, may, with chronic pain, for example, may take, a dose of an oil, before bed. And then during the day, they may use a vaporizer as needed to kind of treat breakthrough pain. And so it really also depends on the person who you're prescribing for. Some people are like, I'm never going to smoke anything. Like, I'd prefer to use an oil. But some people, they want to inhale their cannabis, their medicine essentially. And so there is that option for us to prescribe the dried flower to use inside a vaporizer. Okay.
Yeah. That would be the cleanest method of inhalation.
Correct. Yeah. Of course, we said, when you burn the plant, you concentrate the THC, but you're also producing, the byproducts of combustion, and you're also, unfortunately, losing a lot of the other plant properties that could be having a medicinal effect. So,
okay.
Yeah.
Our podcast is about peak performance, and I'm curious how you would define a peak performance life.
Oh! A peak performance life to me is living a life of purpose. I feel that when you are living your life and your focus is on something that lights you up and gives you drive and passion, then you are more likely to want to optimize everything else to support that goal. And so, when we find what we love and when we find what drives us and what gives us that sense of purpose, I feel like that is a strong motivator to make sure that, we actually want to live a full, long, healthful, fulfilled, exciting life. Life is short, and we don't have enough time to just like coast along, and and so a life of purpose, I think, is.
Okay. And what habits should we cultivate to live our life with peak performance? So
definitely pay attention to our food. I think that's like something that we've spoken a lot about, but I think the importance of, food is information. And if we start to see our food that way, Michael Pollan says, eat food, not too much, mostly plants. And so, just finding your rhythm with regards to how can you use food as fuel it's a game changer. Movement, I think movement is so important, even if it's not like specific exercise, just getting movement throughout the day. Detoxing from the people, places, and things that don't serve us. Getting good sleep, so important, and managing our stress. I think those are
good habits.
Those are key.
What habits should we avoid?
What habits should we avoid? I think habits that are moving us towards a false sense of satisfaction.
Oh, I like that.
So when we do things, really beginning to understand, why am I doing this thing? And is it really giving me the satisfaction that I think that it's giving me? Because if it's not, then it's fake, it's false, and could be actually causing harm. So I'd encourage everyone to just examine, what are the things that you're doing, why are you doing them? You're moving towards pleasure, but is it really satisfying you? And if it's not, then how can you find the things that are truly nourishing and satisfying, rather than just getting that sense of satisfaction without
temporary sense?
Yeah.
I have a quote that I think resonates with you. We end every podcast with a quote or a poem that, at least in my opinion, sums up the guest. And this is a quote from Thomas Edison. "The doctor of the future will give no medicine, but will interest the patient in the care of the human frame, in diet, and in the cause and prevention of disease."
Love it. I've actually quoted that exact quote in a few talks.
Oh, that's amazing.
Yeah, I love that quote.
Okay,
that is my hope for the future.
I'm so glad.
Yeah.
It was such a joy to have you, and what a fascinating conversation.
Thank you so much for having me. It's been awesome being
people
here.
will enjoy this.
Good.
Thank you so much.
You're welcome. Thank you for having me.